All right, doctors are calling it a public health issue, a problem massively underdiagnosed. We're talking about 1 million kids suffering from some sort of a hearing loss. And while it's a law in the state of Maryland that every child have a hearing screening at birth, some kids will fall through the cracks. ABC 2's Ashley James reports.
Doctors say most kids who suffer from hearing loss are born with a degree of it, but if left untreated, it can really have a negative effect on a child's life. In fact, studies show a child that has hearing loss in even just one ear is up to 10 times more likely to fail a grade. Dr. Brian Kaplan is the chair of the Department of Otolaryngology at GBMC. Dr. Kaplan says when it comes to hearing issues, parents are actually not very good at being able to pick up on it, oftentimes confusing it for behavioral issues.
The kid was zoning out. The kid was hyperactive. The kid had trouble focusing on a task. And certainly that could be that child's behavior, but it can also be a sign of hearing loss.
So what are some other signs to look for, especially in the little ones?
For real little ones, there often aren't good signs. A lack of a startle response in a baby, a lack of being able to track and localize to a sound. So if a doorbell rings or a dog barks, do they turn their head? But the babies really need to be screened.
When it comes to helping our kids, Dr. Kaplan says education is key. And with kids getting ready to head back to class, both parents and schools need to be on the same page.
The school system has to be educated as well, and the teachers in the classroom to find out what are some specialized programs, how should we seat the child, how should we look at the child when we're asking them a question, do we need to repeat the question, just to make sure that that information got from the teacher to that child with the hearing loss. If you don't treat that kid with hearing loss and you follow them for their entire life, they have upwards of $250,000 less earning potential as a child who you dealt with early on and got them the help that they needed.
So screening is key. Dr. Kaplan says hearing aids help the vast majority of kids with nerve hearing loss, and nowadays they're so small, almost invisible to people. They've also become wirelessly connected. You can even connect them to televisions, computers, and even your cell phone. For ABC 2 News, I'm Ashley James.
And Ashley says it's important for parents to know that hearing loss is typically not caused by ear infections. That's very rare, so doctors say don't panic every time your child gets one. Looks like